Hello, my name is Emily McGrath and I am from Louisville, Kentucky. Today we will be discussing issues with healthcare accessibility within the rural and urban communities with greater emphasis on the rural population. With all of the medical advancements that have been made as we adapt to the changing health demands of the public, there are still challenges that make access to healthcare significantly difficult for many people. The objective of this analysis is to identify the barriers to healthcare delivery and devise strategies to minimize the burden of poor healthcare. The obstacles identified include, but are not limited to, lack of insurance, financial hardships, physician shortages, and geography. A study conducted in 2018 explored the difficulties to healthcare access, discovered that those living in rural areas tend to visit the ER more frequently as a result of physician shortages, lack of after-hour options for visits, longer travel times, or difficulty with accessing modes of transportation. This creates an environment for poor patient outcomes, especially for those with chronic issues that demand accessible health services but are unable to seek adequate care and go untreated. The CDC, as of 2022, determined that the number of U.S. citizens that were uninsured reached 31.6 million. There are policies in place that have made insurance available to everyone, like the Medicaid expansion, but have still fallen short. Those that reside in areas of poverty or are part of a minority group may not benefit from this for reasons such as poor health literacy, previous negative experiences with healthcare, or simply because of the difficult application process. Furthermore, being insured doesn't mean that one can still afford health services. With the implementation of better health insurance, we also saw an increase in health costs. Finances play a large role in the utilization of healthcare amenities. To put it in perspective, as of 2021, 11.6% of U.S. citizens were classified as living within poverty. Within Kentucky, rural poverty stands at 19.2%, while urban stands at 12%. Geography that is less than ideal, lack of transportation, or long travel distances can prevent a person from seeking medical treatment. This also coincides with the shortage of physicians within rural areas, forcing people to travel to see a doctor. Long distance times can be identified as being longer than 30 minutes to an urgent care or longer than an hour to a PCP or specialist office. For the working population of rural areas, taking that amount of time out of their day for their health isn't always an option. Internet accessibility can also pose a challenge to healthcare. Since the recent COVID pandemic, the use of telehealth significantly increased, making it easier for someone to see a physician or nurse practitioner without having to leave their home. However, there are areas where internet access is inadequate. A study done in 2021 uncovered a link between internet access and speed to the use of technology to support something called electronic patient engagement. Patient involvement in their care is essential. In today's world where technology is heavily embedded in the healthcare system and pretty much in every aspect of life, it is important for healthcare providers to ensure that patients they care for have the ability to use it. As with anything in the healthcare system, there are always some ethical dilemmas to consider. As a provider, it is going to be important to understand how different people of communities and cultures define exactly what health is and exactly what it means to them. Trying to make healthcare accessible to everyone is only half the battle. People actually participating in their care and utilizing health services is the other half. In terms of the rural population, being healthy means being able to work. Seeking medical attention sometimes is only deemed necessary if their health interferes with the ability to provide for their family. Developing a relationship with patients requires an understanding of their opinions of health and a mutual respect of health priorities, even if it goes against what a physician thinks is best for their patients. The culture surrounding rural communities could also promote some ethical predicaments. Relationships between people are closer than you might find in urban areas. Those that you treat are going to be people that you might encounter outside of the work environment. Maintaining boundaries is going to be essential to keep one from potentially violating patient rights. The nurse practitioner may also encounter difficulties with providing care, especially in rural communities. These barriers can stem from lack of resources or amenities resulting from closures of health facilities due to physician shortages. The nurse practitioner may need to devise alternative strategies to provide care with limited resources. Additionally, there is a large misunderstanding of what value a nurse can bring to a community. This is in large part due to restrictions that are placed on what a nurse practitioner can do regardless of their education. Therefore, there is a lack of what they are trained to do and misconceptions surrounding the idea that a nurse practitioner can provide just as abundant quality of care to patients as a physician can, and ultimately fill in the gaps of physician shortages in underserved communities. Ultimately, the big picture is that if access to healthcare can be enhanced, we are going to see higher quality of care being given and improvement in patient outcomes. We have to minimize the gap between those who readily have access to healthcare and those that don't. For one, there needs to be a better process for applying for health insurance by reinstating individuals that can assist with educating people on what the insurance will cover and walking them through the application process. Secondly, telehealth is extremely beneficial for those who are not always able to get to a provider's office. It enables providers to reach target populations that may have distance barriers or may not be able to afford ER treatment. Providers should also coordinate with other physicians to develop treatment plans for those, let's say, who require input from a specialist but cannot physically get to them. Finally, the most important thing that a provider, especially a nurse practitioner, can do is to be involved in policy. We need to be the voice that creates change and breaks down the walls that prevent all people from accessible health care. Everybody has a right to receive medical care and done so in a manner that is affordable and readily available. With that said, the reality is that there are significant barriers that prevent some populations, both rural and urban, from receiving suitable care. There's been a vast improvement in the healthcare system, but there is still a significant amount of people who do not benefit from it. Nurse practitioners can be the solution to that problem. They specifically play an essential role to the service quality of healthcare and create positive impacts on patient outcomes. With that said, there are two questions that come to mind for further discussion. First, in the midst of physician shortages, do people still prefer to see a physician over a nurse practitioner, and how can that affect our care? Secondly, health insurance does assist with a majority of medical costs, but what other assistance can be developed to help with additional health costs that some people may not be able to cover on their own? It is important to remember that healthcare is a basic right for everyone, and it shouldn't be this difficult to obtain.